Hi, my name is Ken Cutbush. I'd like to talk to you about the risks associated with having a sternoclavicular joint stabilisation procedure. So we're talking about this joint here, the sternoclavicular joint, or SC joint. This is just an example of me fixing a sternoclavicular joint. This is where the operation is. You can see sternum, clavicle, and this is a tendon allograft that I've used. This is a little introducer that takes it through the bone tunnels. We take it through bone tunnels and wire it over the top after dealing with the actual sternoclavicular joint issue itself. I tell patients that there is a risk of infection, less than 1%. The sternoclavicular joint, the operation is normally pretty reliable, but maybe not quite as reliable as some of the operations that we do in terms of getting the outcome, the desired result that we're after. There are, of course, risks to all the structures just in behind it. You've got your major vessels, your trachea, and your heart, and so on, lungs down behind there. And they're very close to where that sternoclavicular joint is. And you need to think about that when thinking about having one of these operations. While extremely rare, exceedingly rare, injuries to those structures have been reported, and some of those injuries have led to loss of life. Now, this is a paper published in Journal of Shoulder and Elbow Surgery by Van Dijk et al. In 2020. If you'd like to go to the paper itself, scan that QR code, it will take you to it. They reported a group of 68 patients, 26 of who had a complication, or 38% of them. That's quite high, much higher than what I see in my own experience of this operation. Reoperation occurred in 38% of patients. Infection occurred in 23%. That's almost a quarter of their patients. The commonest one was Cutibacterium acnes. I must say that's, for me, infection rate is around 1%. Instability, 13.2%. So that means the sternoclavicular joint was unstable after that operation and gave symptoms of instability. Arthritis, normally we're doing this operation for arthritis, but they reported a 1.5% risk of arthritis. And they brought up issues with the brachial plexus, the nerves to the arm, vascular injuries, esophageal injuries, or tracheal injuries. All of those things need to be considered. So this is an operation you wouldn't undertake lightly, and it is something to consider when thinking about sternoclavicular joint operations. I hope that helps you. Thank you for listening.